I'm Nicole Shanahan, Bobby Kennedy's running mate. Welcome to Back to the People podcast, which highlights the growth of a movement uniting America, where our government is free from corporate capture and where we give voice back to the American public.
I was actually one of the first people in Houston to start testing. Early on, hydroxychloroquine was buzzing about, people knew about it, but the Texas pharmacy shut it down. And that's when I looked into ivermectin. And I was a skeptic at first.
You know, what the media has been saying, it's a horse tranquilizer, it has no place for human use and doesn't work for COVID.
We all know it's designed for parasites, but it is for humans, not just animals. It's been, I think it was approved in 1987. It's won a Nobel Prize in medicine. In terms of COVID, it blocks the spike protein, blocks it from entering into the cell. And it's been used by over 4 billion people. It's time tested. And you know, the FDA just went on a smear campaign against ivermectin, and we sued them for that because that's not their role. Their role is to approve medications, but they're not allowed to tell the public or not allowed to tell doctors how they can use those medications. You know, they had the backing of Big Pharma, they had the backing of the media. They basically marginalized the doctors that were treating and seeing COVID patients, and not only marginalizing us, but censoring us and attacking us.
When was the first time you were censored?
I remember I was seeing all these breakthrough cases, and what I was finding is, you know, there were more vaccinated coming in than unvaccinated, and they were just as sick, if not sicker. But on this one particular day, I posted 25 times the same message. I said, vaccine mandates are wrong. A few days later, I got a text message from a reporter saying, is it true that your privileges have been suspended from Houston Methodist? And I was floored. And then I go to Twitter, and Methodist is tweeting about me. And they said that I was spreading dangerous misinformation that was harmful to the community.
And here we are in 2024. They haven't really released any explanation.
No one is really talking about it anymore, and at least you are, and Robert Kennedy is, but so many politicians are just trying to sweep it under the rug.
Yeah.
It is imperative that we use this pandemic, this horrible event, and fix things. Because none of us are going to go untouched from this issue.
I think everybody wants to move on because it was so traumatic. But if we move on without understanding what has happened to our country because of this and how it was handled, I think we also let slip the egregiousness of having free speech censored.
Exactly.
And that to me is very un-American. And we are now in an election where both presidents were party to that.
Exactly. The ear is the most challenging of all the things that we deal with as an ear, nose, and throat doctor. It's the most delicate. That being said, it's also the thing that we typically operate on the most. We do ear tubes, usually for small children, and entails making a tiny little incision in the eardrum and then putting a tiny little microscopic tube through that incision. It actually only takes 5 to 10 minutes, and children bounce back right away. So, and they feel so much better. It drains all that fluid out of the middle ear, so it's gratifying.
Earaches are the worst. I have a young child, and always my biggest concern is if something's going on with an earache. She's nonverbal also, and all kinds of things can happen if you don't catch an earache that turns into an infection that could turn into something more serious.
Exactly. And if you see an adult with a middle ear infection, I mean, it brings them to their knees. Like it's quite painful, and I don't think people realize it until it actually happens to them.
Yeah.
And a lot of ear, nose, and throat doctors actually subspecialize to really and become full-time ear doctors because it is challenging, it is very delicate, and there's some interesting diseases that go along with it that aren't too common, but you know, it kind of requires a subspecialist a lot of times to manage.
You opened up your own practice. What year was that?
It was 6 months before the pandemic.
Oh, okay.
Yes.
And before that, you were working?
After residency, I joined a small practice in Houston and worked there about 7-8 years. started having children, and I had 4 boys in 5 years.
Wow.
So I was going to just take 1 year off, and then I got pregnant again. So that 1 year off turned into, I worked part-time for a little bit here and there, but I basically took about 7 years off.
So you had 4 boys in 5 years, and you're raising this family, and you decided you wanted to start going back to work.
Exactly. So, but I wanted to go back to work and do it on my own terms. I did not want to be beholden to insurance companies. That was my biggest frustration in my prior practice, is that I'd have to get approval for so many things before doing them, on the patient. Like, for example, a very simple thing that we do on most of our sinus patients is an endoscopic exam of the sinuses. It takes 5-10 extra minutes. And if you bill the insurance company for that, odds are the insurance company won't pay for it, and the patient gets some ridiculous bill, $400, $500. So it's always, struggling. Okay, can I do this exam on a patient? And then anytime you do surgery on a patient, it was a struggle to get paid. And so what I decided to do is, it's called direct specialty care. So I call myself third-party free. I don't contract with insurance companies. I don't contract with hospitals. I don't contract with the government. And the only people I work for are my patients. And that has given me such freedom. And I believe in transparency. So you can see all the prices on the website. Patients can get reimbursed from their insurance companies after they see me. And the volume is a lot lower, but the quality is much higher. So I spend so much more time with my patients, and it's just a whole, the other thing I found, having 4 kids in 5 years, was what it's like to be a patient. So
Yeah.
Houston is home to the largest medical center in the world. There's 61 hospitals. Trying to navigate your way through the medical center to your doctor's appointment is grueling. I mean, it's like going to the airport. You're going up this massive parking garage, you're going down an escalator, up an elevator, down another elevator. It's just 30 minutes from trying to park to actually get to your doctor's office. And when you're pregnant, that's highly unpleasant. Then you get to the office, and somebody at the front opens a sliding glass door, doesn't even look at you, throws a clipboard at you, and has you fill out a form. And when you're over 5 years, I must have filled out 100 of those forms, the same information every time. Then you sit there, and you don't know how long you're going to sit there. And you might sit there for 15 minutes, you may sit there for 3 hours, but no one tells you. You're just waiting. So it would wreck my day. And when you're working and you've got small children and you're trying, it was just, it motivated me to change things. And I purposely have my location, my practice, in a strip center so people can park and walk in.
Yeah, there's tons of parking outside. We're looking at the parking lot, and very easy. It's a beautiful space.
And I hire people that make eye contact and are friendly and respect people's time. The whole experience is to make it easy and psychologically feeling better before you leave the office. Because most people, you go to the doctor, you don't really feel much better when you leave. You're usually irritated.
Yeah.
Our goal is to make people feel psychologically better. Hopefully physically too, but that's not always possible, but at least psychologically better when they leave our office.
Over the years, even in California, there's been a few of these huge providers, medical care providers and owners of hospitals, and they've consolidated so many of the small practices in California. And so if you're in an area, you have maybe 1 or 2 options of where you can go. In our area, it's Kaiser or it's Sutter Health. And finding really strong solo practitioners had become, over the last, really it's about 20 years, harder and harder and harder, because they all consolidated in. And as a result, they've tried to figure out how to streamline those services. And every mom and dad in America knows how hard it is to get care for your child, basic care. And it's just regular checkups or ear infection checkups. And getting these appointments now has become a bureaucratic nightmare
Right.
for most families. So I think what you've done is a solution to that.
I'm a specialist. It's a little bit different, but I recommend everybody look at something called direct primary care. It's like affordable concierge care. It's like a gym membership in terms of how much it costs. But you get same day appointments. You get, more time with your physician. You're not wrangling with the insurance company over the little things. They're not all like-minded COVID-wise, but at least, you're going a little bit outside of the system and saving your insurance for the catastrophic care, the cancer, the car accident, the major surgery. But just like with a car, you don't use your insurance to change your oil, right? You use it for collisions. And if people could sort of shift their mindset with healthcare, I think they'd be a lot happier and try to avoid these corporate megaliths of healthcare that are just, their interest is financial over everything else.
Let's talk about the pandemic. So you opened this clinic 6 months before the pandemic. So this is 2019. Then it's the start of 2020. In March of 2020, you, like every other medical professional in the United States, is being told we're going into a lockdown. What were your initial thoughts during that time?
I remember seeing it on the news and thinking, it won't be a problem for me. I'm not going to have to deal with this, because I was this tiny little clinic. I didn't have a lot of patients. I had a pretty slow, quiet practice. I'm like, that's not really going to be an issue. I was in denial at first. I was actually one of the first people in Houston to start testing, because LabCorp had the test, but no one knew it. And I don't know why. They were the health department could do it, but the people the other doctors out and about weren't doing it. And we started using LabCorp to test people because they were asking. And then LabCorp got completely slammed. It was taking 2 weeks to get the results back. We had been working with a lab already for chronic sinusitis patients, and they had a PCR test for bacterial and fungal infections of the sinuses. They came up with a PCR saliva test for COVID, which was great because patients could sit in their car. We could hand them a cup. They spit in the cup. They leave the cup outside the door. It was contact-free. And then we were able to get the results back the next day. So, while everybody else at LabCorp was getting the swab up the nose, and it was taking 2 weeks. So my little clinic exploded because of
testing.
Just the testing.
So it was really hard to get access to testing early on.
It was, and they were rationing that.
Yep.
And I used to call everybody when they came back positive because I thought it was so serious. It was so serious.
Yeah,
like,
and the CDC was tracking these cases
so
closely.
We were sending it to the health department,
Yep.
and I would say, well, go talk to your primary care doctor. That's, I'm an ear, nose, and throat surgeon, and then they'd come back to me saying, well, my primary care doctor won't see me. They've shut their doors, or
oh my God.
all they did was give me a cough syrup, or they said just wait until you can't breathe and then go to the emergency room.
Go to the ER. Yep.
Early on, hydroxychloroquine was buzzing about. People knew about it, but the Texas pharmacy shut it down. They restricted hydroxychloroquine, so I knew that was going to be a problem. But I started doing breathing treatments, and I did steroids, and I would treat for secondary infection with antibiotics, and that went well. And then monoclonal antibodies came out, and those worked great. Those turned people around the next day. And initially, I could get as many doses as I wanted. I would order them straight from the manufacturer. They'd show up the next day, unlimited supply. And then the government took over distribution, and it became harder and harder to get them. And so I still had sick people coming to me, because at that point, people knew they'd come here to get treated for COVID. And that's when I looked into ivermectin. And I was a skeptic at first. I really dug into the safety. I looked at the FDA's original data where it was approved for human use on the FDA's own website, looking at toxicity data. And I also did a literature search trying to find accidental and intentional overdoses from ivermectin. And once I did those two things, I was very comfortable that it was safe. And then I started using it to see if, I was again a skeptic. I'm like, I'm not sure it's going to work as well as monoclonal antibodies, But it did. And what I found is that, it wasn't always just ivermectin, but everybody that I treated early is alive and well. And now I've treated over 6,000 COVID patients.
Wow. Wow. So you opened this place effectively right on time for COVID in many ways. And you were uniquely positioned to see these patients because you had already had that relationship with the lab.
Mm-hmm. Right.
And you understand the nose and you understand breathing.
Right.
Which was the biggest, is still the biggest issue for COVID patients. So how did you hear about ivermectin? Because what I've heard about ivermectin is that it's, what the media has been saying, it's a horse tranquilizer. It has no place for human use and doesn't work for COVID. I mean, you came upon ivermectin before the media started telling everybody else this about ivermectin. What is ivermectin?
I have to credit my brother-in-law, who's not a physician, for telling me about it. And he has a sister who lives in Australia, and there's a physician in Australia who was sort of the pioneer with ivermectin and COVID. And so he heard it from her, and then he sent it to me. And I remember reading that and thinking, I don't know. I had monoclonal antibodies at the time, so I just kind of dismissed it. And then I found out about FLCCC, which is Frontline Critical Care Alliance. And it's two physicians, Dr. Paul Merrick and Dr. Pierre Corey, critical care doctors, who were really dug into the efficacy of ivermectin and were using it in their ICU patients and finding how helpful it worked. And they created a protocol. So they had dosages and they had vitamins that went along with it. And so that was sort of my guide, is using their protocol. And then in terms of what ivermectin is, we all know it's designed for parasites, but it is for humans, not just animals. It's been, I think it was approved in 1987. It's won a Nobel Prize in medicine because it's cured river blindness in Africa. It has 20 mechanisms of action. In terms of COVID, it blocks the spike protein, blocks it from entering into the cell, but it also has the anti-inflammatory properties. They're also now finding it may have some benefit with cancer. There's a lot of studies going on about that. And it's been used by over 4 billion people. It's time tested. You can't go to Walgreens and get it anymore, so it's become expensive because you have to go to compounding pharmacies to get it. But it's extremely safe. I haven't had any serious reactions in the 6,000 patients that I've treated with it. Antibiotics, I have a much harder time with side effects. Mm-hmm. I rarely get any calls about issues with ivermectin.
I've heard bits of the story. I heard about the Nobel Prize, but I didn't understand that it functions in so many different ways across the immune system, mm-hmm. And quite delicately, it sounds like.
We see this a lot, this off-label prescribing, something going around, because we're using ivermectin off-label. The FDA did not approve it technically for COVID, but...
What is it approved for?
For parasites.
For parasites.
But, about 30 to 40% of medications we use are off-label, and mm-hmm. prior to COVID, I never really considered whether a medication was being used off-label or on, it was just, we weren't trained to think that way. We were trained to, see how it worked clinically. If it's working clinically, we mm-hmm. use it. There was nothing in my training where, okay, you have to adhere to FDA guidelines for every medication. Mm-hmm. Did not become an issue until COVID. And the FDA just went on a smear campaign against ivermectin, and we sued them for that because that's not their role. Their role is to approve medications, mm-hmm. But they're not allowed to tell the public or not allowed to tell doctors how they can use those medications. And they put out the famous tweet of the attractive healthcare worker nuzzling the horse. Mm-hmm. It says, seriously, you're not a horse, you're not a cow, y'all stop it. Mm-hmm. So that went viral. The media grabbed it, ran with it. That was when Joe Rogan came under attack. Mm-hmm. But it caused a lot of problems. I mean, pharmacies wouldn't dispense it. Hospitals wouldn't allow patients to get it. Even judges, there were court battles, and they would cite the FDA as the reason. So it had dire consequences.
It's kind of unbelievable to think that the FDA could impact so many functions and so much of the independent standards around doctors treating patients. That seemed to be something that became very common during COVID, that these agencies, which typically have allowed doctors to practice independently, all of a sudden decided to, across the board, tell doctors what the standards were for treating COVID patients.
Exactly.
And this is not typical. This is,
yeah.
has anything like this ever happened before?
We had government doctors
Yeah.
who had no firsthand experience treating COVID, never seen a COVID patient, never prescribed medicine for a COVID patient, who were sitting at home over Zoom meetings dictating how this would go down. And they had the backing of Big Pharma, they had the backing of the media, right? And so they gave everybody the impression that they had the authority to do that, but we've never seen anything like this before. They basically marginalized the doctors that were treating and seeing COVID patients, and not only marginalizing us, but censoring us and attacking us.
When was the first time you were censored? Can you remember?
Well, I was kicked off a couple local online groups. There was the Houston Women's Physicians group on Facebook, group of female doctors that just attacked me and then kicked me off. I was kicked off another local Facebook group called Westview Information Trading. Same thing, just, I was pretty careful initially. I was trying not to rock the boat, but it's just, I couldn't win, because they thought that because I wasn't doing a swab that I wasn't legit, because I was doing saliva instead of swab. Or, if I posted my results, they'd say I was either fear-mongering or downplaying the pandemic. And then I got kicked off Twitter. That was the big one for 5 months. Been kicked off basically every platform at some point.
Oh my gosh. That must be very strange from going from a doctor with a practice of your own that you're just starting up, you're a mom with 4 kids, and I read you're not like really into politics. You've kind of have lived a very quiet life until you realized there was something going on, and it wasn't even that you realized something was going on. You're just doing your job by telling folks how to treat this virus.
And I really didn't, I was online, I was posting things on social media, but I really didn't have much of a presence. It wasn't really until Houston Methodist went after me that my name got out there. And that was basically, I had privileges at Houston Methodist. They were the first hospital in the country to mandate the COVID shots.
Wow.
Yeah, so they did it April 1st, 5 months before Biden.
April 1st of 2021.
Yes. And at the time, I was collaborating with them because I had so much data from testing, and we were trying to publish studies about it. Seemingly had a good relationship. And then I remember I was seeing all these breakthrough cases. I was seeing all these people, because I would track who was vaccinated and who wasn't, and I would track their symptoms. And what I was finding is, there were more vaccinated coming in than unvaccinated, and they were just as sick, if not sicker. And so I reached out to Methodist, the people I was working with. I said, hey, are you seeing what I'm seeing? And, they get the whole gaslighting thing. Oh, no, everything's fine. It's just lowering the severity, that sort of thing. So then I started speaking out on social media, but I didn't have much of a following at all. I mean, I don't know how many followers I had, but I get like 1 like, if any, on my post. But on this one particular day, I posted 25 times the same message. I said, vaccine mandates are wrong. And then under it, I did a patient testimonial, because I had been sending out emails to patients, and I'd get feedback, that sort of thing. And so I did that 25 times. And then a few days later, I got a text message from a reporter at the Houston Chronicle saying, is it true that your privileges have been suspended from Houston Methodist? And I was floored. I was blindsided. I said, well, no, I don't know what you're talking about. Please check your sources. And then I go to Twitter, and Methodist is tweeting about me. And they said that I was spreading dangerous misinformation that was harmful to the community. And I mean, the story went global. I literally had people from Australia. I had good and bad, but I got all sorts of names thrown at me, and
this is just, you're speaking out against mandates.
Right.
So
I wasn't
requiring
even-
people to get the jab to do basic things in the community.
Exactly.
And that's all you were saying. You weren't saying recall it. You
No,
weren't
I
saying at that point, like, there was, I mean, did you know that there were side effects? Were you speaking out about?
Not to the degree that I see it now.
Okay.
But because I was in this hub at Houston Methodist, I had so many people coming to me, very distraught, trying to figure out what to do.
Yeah.
I've seen it wasn't working, right?
So if it's not working, why mandate it?
Right.
Let people have informed consent.
Right.
That they'll still get the jab, which we don't know what the side effects are, but it won't stop you from getting COVID.
Exactly.
So that's all you were saying.
Right.
I mean, this is very standard. I mean, according to the oath you took when you became a doctor, this is what you're supposed to do.
Right.
This is a duty.
And 3 years later, it seems like a no-brainer, right? Why would we mandate these shots, right? It seems like very weird that we did that.
For some schools and some jobs, you still need to get it.
Yeah, so they didn't like me stepping on their toes, and after that is when the media caught on to me, and then I grew, for better or for worse, in terms of my voice.
Did you meet other doctors during this time that were on a similar journey?
Yes, and that's been
What was that
nice.
like?
I mean, on one hand, I've been completely ostracized by 98% of physicians out there.
Yeah.
But I have connected with a lot of new doctors and very loyal and good people.
I just find that story so hard to believe. And here we are in 2024, day before Mother's Day. We're still kind of dealing with this. They haven't really released any explanation for how we got to this moment. And has anyone issued an apology to you?
Oh no, absolutely not. But I feel like we're on the verge of things really breaking open. I mean, we've got the COVID Select Subcommittee seems to be probing more.
Good.
We have AstraZeneca just pulled their product off the market.
Yes, that was a big one.
We have Brooke Jackson's lawsuit. I don't know if you've been following that.
No.
That could just take the whole house of cards down. She's a whistleblower. She was working on the research end of the shots, and she revealed all these issues going on with the way things were being handled during the trials, and now she's suing them. But it's been a big struggle, as you would imagine. There's appeals and all that. They're fighting tooth and nail to get their case to go forward.
Well, that sounds like it will have a really big precedent.
Yes.
We're already seeing media talking about a new H1N1 coming through the States. What do you think about that?
From what I understand, because I get alerts from the Texas Health Department, the patient that suffered H1N1 had conjunctivitis, which is pink eye, and they're trying to make this out to be some horrible disease. If it does turn out to be a serious issue, it might be what we need. It might be, because I don't think people are going to put up with what happened last time. I think we almost need something like that to remind people, because if people are starting to forget, they're trying to move on. And COVID is an issue that affected every single voter, every person, right? No one is really talking about it anymore, and at least you are. And Robert Kennedy is, but so many politicians are just trying to sweep it under the rug. And
It's, look, I mean, I can talk about my experience. My background is I'm an attorney. I did patent law. I built software. I'm an academic at Stanford. And then I, do some tech investing and philanthropic giving. And I will say that from my perspective, being a donor to politicians, it's hard to find politicians willing to take this on, because this is one of the biggest issues that has impacted our country in all of our lifetimes. It's changed executive powers in this country, how we think about them. It's changed how we think about the power of these agencies. It's impacted private life in every single way. It's touched every part of it. Our children, were thrown online for 8 to 9 plus hours a day, and we know that's not good for their psychology. They were separated from each other. They were made very fearful of getting sick as well. Trust in the media is at an all-time low. I think everybody wants to move on because they want to move on because it was so traumatic. But if we move on without understanding what has happened to our country because of this and how it was handled, we run the risk of not only doing it again and letting these powers that be continue to get away with it without accountability, but I think we also let slip the egregiousness of having free speech censored. We overlook the egregiousness of the people that are saying that they have been vaccine injured by this vaccine. We run the risk of not figuring out how to do it better the next time something like this comes around, and to get to information that allows communities to actually feel safe in those moments. Because like you said, they're not going to tolerate that kind of lockdown again.
Right, and I think the trust is gone. I mean, the most common question I get asked is, who can I go to? Where can I go if I need to go to the hospital? I mean, we are all going to touch a hospital at some point in our lives. I look back, I've been in the hospital 7 times in my life. I was shocked. Prior to the pandemic, I never gave it a second thought. I'm going to the hospital.
Yeah.
That's where I'll be safe. That's where they'll save me. And now, no, I mean, everybody's terrified to go to the hospital. And how horrible is that?
Yeah.
It is imperative that we use this pandemic, this horrible event, and fix things. Because none of us are going to go untouched from this issue.
What would you recommend physicians do in this moment if they are too worried to speak out? What are their options?
I mean, the more people that speak out, the easier it is. And unfortunately, even now, people just don't want to. I mean, they see what they've done to me. I mean, I'm dealing with the medical board basically for speaking out. If you Google my name, it's awful if you Google my name. And most doctors are not outspoken to begin with. We're rule followers. You have to make straight A's. You got to stay in your lane to become a doctor. You don't rock the boat, right? And I've never been in the military, but I imagine residency is similar. You follow orders and you don't stray outside those boundaries. And so we are, personality-wise, we're not as likely to speak out, and then we're trained to stay, a certain way. And so I don't know. I mean, we definitely need more people speaking out. I think it's first and foremost. And, social media is a good way because it's like the town hall, and especially Twitter. You can get your voice out there.
Do you think that physicians would be more successful with their patient care if they could have more objective thought? Yeah,
I think autonomy. I mean, I think everything is so protocol driven, and that has changed. I mean, when I got out of residency, it was just starting. But it's been 20 years now, and basically Medicare reimburses you based on following a protocol, not just COVID. I mean, pneumonia, sepsis, heart attack, you have to check the boxes, and if you don't check those boxes, you don't get paid. And some of that is good, I think, but it's gone too far. And these doctors that use these electronic medical records, they're drop-down menus. So their choices, they have options, but they're limited to those options.
Yeah.
They can't just write in what they want. And then, it's a big mess. We've got the insurance companies also dictating care. I mean, I can't tell you how many times a day I hear from a pharmacy, it's not just ivermectin, it's all medications. Oh, insurance won't pay for that. Can you find another one? And it's endless. It's all day long. So we've got all these people
who are not doctors.
Coming between the doctor and their patients.
And they're telling doctors what their options are and how to treat their patients.
Mm-hmm.
Is there a model out there that you think the United States should look at in terms of handling payments, and any country in particular that does a better job with autonomy and transactional efficiency?
Not that I'm aware of, but I do think it's like I said with the car insurance. Move away from using insurance for your basic healthcare needs. Mm-hmm. Use insurance for catastrophic care, and for your basic needs. Find somebody that's outside the system. Start with that. That movement is growing. It's getting, and I predict that is going to just get bigger and bigger and bigger. Mm-hmm. We need insurance for some things, right? And we need a safety basket for the people that don't have any money. But there's so many ways that we could make. For example, if I take out somebody's tonsils. If you go to Methodist Hospital, it will cost you $17,000. If you come to me, and I don't get paid, this is part of the whole thing, anesthesia in the surgery center, it's $5,000.
Wow.
Right.
It's a third.
Just little things like that. If you get anything done at a hospital, the price just goes way, way up.
That's so unfortunate, because the whole motivation behind centralizing all of these services under one umbrella was for reducing costs, because the original thinking was you get to this economies of scale when you combine all of these services.
Right.
But that's not the case.
Houston Methodist has over $13 billion in assets. It's a nonprofit, right? So doesn't I don't know. I just think we need maybe a little more oversight into these hospital systems.
Agreed. I've heard similar stories. And certainly, I've met some of these administrators of these large systems, and they are MBAs, they're, business people, they have worked for profit in healthcare services, and now they're leading these nonprofit centers with a similar mentality. And it seems like who really ends up bearing the burden and the costs are the patients.
Exactly.
And then our taxpayers.
Right.
Because our taxpayer dollars are now covering many of these larger bills.
Right, exactly.
Oh, well, how's your practice doing now? I know you're fighting the good fight still with Ivermectin. It still remains very hard to get some of these prescriptions filled, I understand.
Yeah, I mean, we sued the FDA, and the FDA settled, but we look at it as a win because they basically did what we were asking them to do. They took down the misinformation on their website about ivermectin. They took down the social media posts.
Congrats.
Yes, it was gratifying.
That's huge.
But we have 3 years of propaganda to reverse, because they took those things down, people haven't been educated. We have to re-educate people that it's still that it's safe and effective. And we now have 102 studies looking at ivermectin for COVID. And,
wow.
Yeah, people don't realize that. There's plenty of data out there. I keep challenging Walgreens and CVS and all these other pharmacies to dispense it, but I'm not having much luck yet.
Why do you think that is? I know that Walgreens receives state and federal funding from time to time for various things. Do you think it's because there's a conflict there with some other agreement they have?
Well, I hear different stories from different pharmacists. The last pharmacist told me that it was actually the Texas State Board of Pharmacy that was putting the restriction on them, that if they were going to dispense ivermectin for COVID, the Board of Pharmacy implemented some sort of step in their system where they'd have to do an override, and it would get flagged, and then it could go to the State Board of Pharmacy, and then that pharmacist could get in trouble. But
the pharmacists would individually get in trouble?
That's what this pharmacist told me yesterday. I tweeted about it. I've had other people say it's just my individual, the pharmacist takes the responsibility. And, they are allowed to refuse to dispense medication, but the spirit of that law was for the abortion pill. So if they feel like there's a moral conflict and they don't want to dispense the abortion pill, they don't have to. but they're abusing that law. Ivermectin is not a moral issue, right? It's
No, and
it's
the FDA,
political.
and the FDA, has finally admitted that they were wrong.
Right,
In that
right.
position where they were forced to admit that they were wrong.
Right, right.
And you would think that, through that settlement and through that final opinion, that would then, work backwards through the government and inform other aspects of the government that ivermectin is indeed safe and effective.
Right.
Is that happening? Is that kind of...
Well, now we have Chris Cuomo who said it's safe and effective. So
Yeah.
that's all we need, right? We just need the media on board, basically.
Right. Yeah, he did very publicly say that he has been treated with ivermectin, and brave. Good for him.
Yeah. Well,
I just wanted to come here today to see you in Houston because I really think the people out there who have stood firm in spite of this existential threat to your livelihood, this existential threat to your reputation, you put it all on the line to treat patients and to bring forward the truth and to fight what has been such a Goliath in terms of, all of our biggest, most powerful institutions in this country saying that, you're somehow risking other people's lives with your well-informed opinion as to what was actually going on during this time. It's hard. I can't get past this, and I know Bobby can. I know many people part of this campaign can't just move on knowing that people like you were so wronged, and that as a result of you being wronged, so many other people had to suffer. I don't think we can operate as a free country unless we actually take a stand for this. To hit our economy, and we have to recognize that, how we're still in, that incredible, crawling out of the gouging out of our wage labor workforce. I mean, this is a community that was most impacted. Our Constitution. I mean, that is the largest pillar of all of this, is that you were censored.
no, I mean, the executive branch took over in ways we've never seen.
And that to me is very un-American. And we are now in an election where both presidents were party to that.
Exactly.
And it's unacceptable. And if the American public doesn't have a choice to vote for an option that stands for these things, like the First Amendment,
Exactly.
and, accountability of censorship of our health workers.
And your campaign has been censored, I hear, right?
Well, Bobby's been censored for a long time. I personally, I'm starting to see little things here and there happening, and I'm throwing, the Democratic Party through a little bit of a loop right now because they don't really know what to do about me. My MO has always been being a grateful child of an immigrant, knowing why my mom chose to come to this country, and that if we want this to continue to be the great country that she arrived to, it's on me, a child of America, to not for a second take for granted these freedoms.
Did you get locked down during COVID?
Yeah.
And were you in Silicon Valley?
I was in Silicon Valley. Silicon Valley was very serious about it. The ethos of Silicon Valley, and again, these are a lot of engineers, lawyers, doctors, is there's a set of rules. And also another part of the engineering ethos is that you can engineer your way through a solution. And so the narrative that you lock down, you stay home, you take the medicine that you're given by your doctor, I raced to get the jab because I thought that would allow me to travel freely again through the United States. I will say that, there were some people in Silicon Valley, very wealthy people, that took the opportunity to go to their, second homes or, go abroad. I was mostly in Silicon Valley, but, for wealthy people, it was a very different story than it was for the average American. My heart broke hearing about some of these stories of people that didn't have backyards.
Yeah.
And I can't imagine.
I can't. I was so grateful to come to work every day as a doctor. I was like, I don't know how people are doing this.
It was in many ways such a truth serum to kind of this devastating reality in America that, the people at the top kind of just scoot by during these crises, and then the middle class and, wage income households, they just continue to just get beat down. So it's like, and communities, low income communities had it the worst. They had the, highest death rates from getting exposure to the COVID virus. This country has not recovered from that. And I don't think we can recover from it until we really address what went down.
And all the small businesses.
Businesses shut down, the parks. Children couldn't run outside.
Right.
None of it made any sense at all.
No.
We have a little, under 6 months now until the election. And I think this is just an opportunity for anyone who wants to talk about it to keep talking about it, because the more that we call out the censorship, the more that we hold people accountable, the more that we restore those reputations of individuals like yourself that were under attack for so long. That is the duty of this country right now.
Are voters interested in COVID?
A lot are trying to figure out what happened. And a lot are trying to understand if they were impacted adversely by the vaccine.
Yeah, because you probably see a whole different side than I do. Everybody that comes in here is very like-minded.
Yeah.
So it's hard for me to get a perspective on, okay, what is the temperature out there? So what people out there, what are their thoughts on the shots?
Well, it's interesting. I was at the National Academy of Medicine last year. I was asked to speak.
Oh, wow.
And it was kind of funny because I was on a panel with the current commissioner of the FDA, a former one, a director from NIH, and the head of the American OB Society. And afterwards, I was invited to this dinner with the president of the National Academy, and Peter Hotez spoke about his new book. And during it, he was citing the crises that science is under because, dog vaccines are down 30%.
I bet. Yeah.
So people have lost a lot of trust, and the only way the government's going to win it back and that vaccine developers are going to win it back is if they start to admit fault.
Right.
Because if they don't do that, they're just going to keep losing confidence.
So you think the majority of the public sees it now?
Yeah. A lot of people are just, their doctors are like, well, I'm supposed to recommend that you get the booster. And they're like, we're good.
Do you know people that have gotten all 9 shots?
Not personally. I don't think those people are in my orbit anymore, but I'm sure that some of the people that have, that are no longer my friends because I've since left the Democratic Party. I'm sure that some of those old former friends of mine have gotten 9 shots, but no one in my current orbit.
So did you have a lot of people just shut the door on you because of joining this campaign?
Well, I had my first big slander Nicole piece for various reasons based on, what we've heard from her friends. And the article called some of these ex-friends my detractors.
Oh, wow.
It's such an interesting thing to think about it in that context, because that's not how I see the world. And it's amazing how vicious people can become when they disagree with something that has been so politicized.
Yeah. No, yeah.
They're willing to take down everything about you, down to, the car you choose to drive, or the shoes you wear, or the outfit, or the tone of your voice.
Especially women, right?
Women get it worse.
Yes.
So it's, I will say that I know that we're all on the right side of history,
Right.
and that gives me great confidence. There are people on the campaign that have had some similar experiences to me, and Jay Carson in particular says, well, for every one friend I lost, I've made 2 more.
That's true. That is true.
Yeah.
It's just hard when you lose really old friends that you've known your entire life, and then poof, they disappear. It's crazy.
It just goes to show the power of programming
Yeah.
and the power of propaganda.
It's very sad.
The power to think for oneself, the power to remember what the Constitution says, that is that sustaining energy. And
Exactly.
there's a lot of it.
Yes. Yes.
So, thank you.
Yeah. Well, thank you.